When you've got kind of the more chronic changes that occur, so ligament laxity or neurogenic inflammation, large majority of the time, those are not going to show up on an x-ray. They're not going to show up, they're definitely not going to show up on an x-ray, period. They're not going to show up on an MRI. And so the way to evaluate for those is through the physical exam. And so if you are considering, or you're not sure if ligament laxity is contributing to your pain or neurogenic inflammation is contributing to your pain, you want to make sure that you are seeking out a provider who is able to evaluate for those things. You probably won't be able to go to your regular doctor who never talks about neurogenic inflammation or ligament laxity and say, oh, can you do evaluation for me for ligament laxity? Because any good physician, if they know something that they could evaluate for and potentially help you with, they're going to do that, right? And so if they haven't brought it to your attention yet, it's probably because they're not educated in that. And that's just how they were trained, and we can't blame them for that. Now, if they're presented data about it and they ignore it and choose not to listen to the data, that's a completely different story. But we can't blame them for just not being educated, because at the end of the day, there's a lot of things that we can't choose in our educational path, and we can't choose that we were taught something or weren't taught something. So if you're struggling in chronic pain, please, please, please seek out evaluations with other providers who might be able to look into ligament laxity, neurogenic inflammation, and then other functional things that can occur, such as tendinosis or some mild pain coming from the cartilage, even though the x-ray and the MRI say it's fine. Please start looking for that stuff, because that's hopefully where you will start to find more answers.